In the last couple of weeks, much of the world's attention has focused on India. And although that country remains in the grip of a severe crisis, we're encouraged by the demonstration of international support for India. At the same time, we must remember that many other countries all over the world are still experiencing intense transmission. As you know, Brazil is one of the countries that has been hit hardest by the COVID-19 pandemic. Since the beginning of November, Brazil has experienced an acute crisis with increasing cases, hospitalizations, and deaths, including among younger people. During April, intensive care units have been at almost full capacity across the country. In total, Brazil has reported more than 14 million cases of COVID-19 and more than 400,000 deaths. Cases have now declined for 4 weeks in a row, and hospitalizations and deaths are also declining. This is good news, and we hope this trend continues. But the pandemic has taught us that no country can ever let down its guard. Brazil has a long and proud history in public health, with 3 decades of investments in strengthening primary health care and progress towards universal health coverage. But the pandemic has hit Brazil's health system hard and threatens to unravel those gains. PAHO and WHO are working closely with the government of Brazil to respond to urgent needs for medicines and other supplies, such as diagnostics, oxygen, and masks, and we have helped to source tens of millions of dollars worth of medicines, which the government can now procure.
The COVID-19 pandemic has become more complex, not only in Brazil, but in all South America. Today, most of the countries in the southern cone and the Andean region are going through new peaks of transmission. Countries like Peru, Ecuador, Bolivia, Argentina, Uruguay, and Guyana are reporting a dramatic rise in infections, and their health services are overwhelmed. Infections in Colombia will soon reach the high levels that they had in January, and intensive care units beds are running out in major metropolitan cities like Bogota and Medellin. These surges in cases have also led to an increase in hospitalizations of younger people. PAHO is orienting the countries to plan on coping with sudden increases in the consumption of critical inputs such as oxygen, intubation, drugs, and personal protective equipment. We are also advising on improving protection of the healthcare workers. COVAX has delivered 7.3 million doses of vaccines in Latin America and the Caribbean so far, but the need for vaccines is much greater. Many countries cannot afford large bilateral deals with producers and are relying on COVAX for vaccines, but the outlook is not optimistic for increased supplies soon.